I am Dr. Lalit Maini, along with Dr. Ankit Khurana from Delhi Orthopedic Association, going to talk about how to make a conference presentation. You need to know your conference guidelines, especially the time of presentation you have allotted, and then apply certain common principles to your presentation. So, the presentation structure we will talk about today would be broadly divided under introduction, the content development, slide design, delivery techniques, and conclusion. The title of your presentation, keep the title concise, reflective of the content, and in the title case. Peacock is a very nice way of presenting a title in medical conferences. Importance of a well-structured presentation. Time allocation. This is very important. Commonly, it used to be 8 minutes of presentation and 2 minutes of question and answer. However, there are various types of presentations now where you might get a speaking time of 5 minutes, 4 minutes, or at times even 3 minutes. So you need to modify your presentation accordingly. Remember, in the audience are your peers, experts, and potential collaborators to your work. List all the authors with their full names and affiliations and designate the presenting author. If you have to structure an 8-minute presentation, try to divide it into various sections and then give adequate time to each. For example, I've laid down this structure in which you can have a minute for introduction, another minute for background and problem statement, spend 2 minutes on methods, and 2 minutes on results. You should be able to conclude in a minute and also give future directions of research and application in a minute. Slide design is very important. You need to keep your slides uncluttered. A light background with a dark font is always most appealing. The background should be a plain background without much designs into it. Use bullet points and short sentences and don't have more than 6 sentences per slide. Visual aids always help, like charts, graphs, and images, but use animation only if necessary. At times, they become a bit irritating. You should use a consistent font and color scheme throughout your presentation. A good size would be 44 font for the title and 28 for the text of each slide. Provide the context for the research problem or gap in knowledge that the study aims to address. Briefly mention the significance or potential impact of the study. Brief overview of the topic, importance and relevance to the audience. Context of the study, clear and concise problem statement, objective of the study. Clearly state the primary objective, which is invariably connected to the research question you are addressing in your study. So the aims and objectives have to be very clear and they ultimately would connect with the conclusion you draw. Methodology, spend 2 minutes on this. Outline the research design, the methods and techniques in the study. Specify the study population or sample, data collection procedures and any instruments or tools used. If you have used any technique described in the past, reference it. Mention the relevant statistical or analytical approaches employed in data analysis and highlight any unique or innovative aspects of your methodology. Results, again, take 2 minutes on this. Present the key findings and outcomes of the study. Use quantitative data if applicable to support results. Report any pattern, trends, or significant observations identified in the analysis. Include specific details such as effect size or statistical significance if relevant in your study. Now, figures, images, and diagrams are very important. A small figure or a diagram would bring out more information than a long detail. The patient identity should be concealed all the time. Your X-ray, CT, and MRI should not be in a color tone. Check images on the slideshow format so that you're sure that your image is not getting broken or blurred out when you go on the slideshow. Embed the videos into the PowerPoint presentation. Don't have them in a folder separate. Always try to label your figures, images, and diagrams. A figure, image, or diagram should actually be complete in itself once anybody looks at it separately. Do not distort images while you enlarge it. When you want to enlarge any image, enlarge it from the diagonal side so that the length and the breadth both change. If you do it from some other aspect, it'll get distorted. Discussion, give it a minute, summarize the main findings, discuss implications and significance. Where does your study fit into available literature? And always reference the literature you're referring to and bring out the limitations of the study. Conclusions should always be connected to the aims and objectives and should not be philosophical. Summarize the main implications of the study findings. Discuss how the result contribute to the existing body of knowledge or address the research question, and clearly articulate the broader significance and potential applications of the study's conclusion. Finally, you have to mention the future directions, suggest areas of future research, and potential applications of whatever findings you have. Now, once you made your presentation, spend some time on your delivery techniques. Practice for smooth delivery within 8 minutes. Engage with the audience when you're presenting. Prepare for a question and answer session. Recap key points for the presentation. And always encourage questions and discussions. Don't forget to thank your audience. The question and answer sessions invariably is great value. Prepare to answer common questions related to your study. Maintain a confident and a professional behavior, and accept if you do not have an answer and commit that you would come back with that. Finally, rehearse multiple times, get feedback from colleagues, stay within the time limit, use a laser pointer to highlight key points, and always follow the instructions of the conference. So all the best. Wish you success for your presentation and see you again with more details.